So we would love to know what exactly is vision therapy. How does this work for children on the autism spectrum?
One of the most important thing you must have seen, like they have poor eye contact, hyperactivity, repetitive behavior, poor social and communication. These are the major important things which we always see, right? If I talk about normal generation, many people have problem the right left concept. They always say where I need to take class. Take this side. They don't understand where is right and where is left. They'll always show with the hand, take this side, this side. Where is the problem? Because you have problem with the bilateral integration.
Let's get a little bit of clarity.
People don't know something about vision therapy. But when they come with the referral, then also, we tell them, oh, this is your child has some kind of visual problem. They are like, I don't think so. He can see everything clearly, but that's not the thing. He can see, but he doesn't understand or process the whole information. What is virtual reality? It's the autistic science which has come because of visual process. What is phone? It's a vision which is changing your whole different process.
I also want to know that how should a parent identify when they have to go to a vision therapist? So welcome both of you to the Dolly Show today. I'm so glad that you both are here, and definitely we'll be discussing about another new topic. So yes, we have our professional who is Dr. Sumith Kumar, and he's a vision therapist.
Thank you so much.
And we have our parent who is Chaitali Karia, and she is a digital creator as well as a proud mother. So welcome both of you. So yes, a new angle, a new topic that we'll be discussing. First, I would love to start with you, sir. So a little bit about your journey is what we love to know.
Okay, so first of all, I would like to say thanks to you for inviting me over here and to explain about my experience, what I have done over the period of 9 years. So, if I'll tell you the truth that I was a learning disabled kid at one time, which I was also not aware about. And I was an auditory learner. I never loved reading in my life till the age of, I would say, 18, 19. And during my college time also, I used to ask my friends that, can you just speak me for half an hour? Because when they used to talk, I used to listen and I used to remember that. And then when the next time when I'll read in the PPT, I used to read that subtitles kind of thing. And that's how I to remember. And next day I used to write that. And that's it. And I never loved reading and writing, both the things. So when I reached in my college, somehow I joined Optometry. I don't know why I did that, but I was really not aware that I am going to become something like a vision therapist. But in the third year of my career, my principal was the first vision therapist of India. And somehow I understood what is vision therapy. And I did vision therapy for myself. And I got better. I started reading books in my life. And that time, about the vision therapy awareness, if I talk about, it was very less. Now also, if I talk about, many people are really not aware what is vision therapy exactly. For most of the people, vision therapy is just like eye movement and all. We show the light. And so just imagine like 10 years back, I would say 10, 12 years back, it was very less. So I did it for myself. And then I thought like the thing which I have gone through, I want to give it to people and I want to transform the life of many people. So vision therapy has changed my life, and that's my goal, that I want to change the life of many people. That's why I'm into the field of vision therapy. That's my journey exactly. So
fantastic. And even we are very eager to know what exactly is vision therapy. So we will discuss about that. Before that, ma'am, your journey, let's go back to memory lane where you started from.
23rd June 2011, Dian came into our life. And I still remember that day very clearly because it was little complicated. My delivery was little complicated. His head got stuck in between, and doctor had to pull it out with vacuum around 3 to 4 times. So because of that, na, when he came out, his head got swollen. But after all these complications, when he came out, he turned out to be like a normal child. So it was not big of an issue. So he had achieved all his milestones according to his age till the age of 1.5. But except his speech and walking. So he started walking little late, but his speech was an issue. So I consulted his doctor. So she told me it's not that big of an issue. He was speaking 3 to 4 words at that time. So doctor told me it's not that big of an issue, but as a mother, na we quite intuitive. So I was feeling that something is wrong with my child, something is missing. But then at the age of 2, I enrolled him in playgroup. So there I have noticed very important thing that all the mothers are talking with their children, and the children, all children are understanding what they are talking. But Dian doesn't have that. Dian didn't have that understanding, and he seemed very scared while going to school. Kept crying, not adjusted to that environment. So I told teachers. Teacher told me it's okay. Many children take time to adjust, so we will manage. Then at the end of the year, she told me that, ma'am, I want to talk to you about Dian. He is not sitting at one place. He is very much hyperactive. He is not obeying with the teacher. And then she recommended me one developmental pediatrician. So I consulted her. I took her appointment. Then she took Dian's assessment. And then she told me, it's good, ma'am, that you came here because he may have difficulties in learning. So then she suggested first to go for hearing checkup. So we did that and it was normal. Then she suggested to go for OT and speech. So we started that. But she didn't tell us that he had autism or something. She told me that I don't want to label the child too early. He's very small. He can improve with time, with therapies. She just told me that he has attention and socialization disorder. That's much longer. So that's how our journey began.
We will definitely discuss further in depth. Before that, let's come back to our very curious question, which is, so we would love to know what exactly is vision therapy.
Well, so before talking about vision therapy, I would like to explain what is vision.
Yes.
So that, it will be easy to understand what is vision therapy. So whenever we talk about vision, for most of us, vision is just like what we are seeing. That's what it is, right? But let's explain it in the detail. So let's say I have to grab this cup of tea. What is going to be the first action what I'm going to do? I'm going to move my eye from one place to another place. For that, I need peripheral vision. So I'll move my eyes. Then my one eye will move and then another eye will also move. Because we have a right eye, we have a left eye and it will coordinate. Then only we will see the single and 3D image. If you won't be able to make it 3D, you will see double. So you need to have a good eye movement. You need to have a good eye coordination. Then you will understand how far it is. So is it over here? Is it over here or here? And when my brain will understand this whole process, then I will move my hand and grab this cup of tea. This is a complete vision or visual process. And this is how the vision works. It's not what we see. It's how your brain process the whole information, whatever you're seeing, and acting upon that, right? So you're organizing the space and everything comes on this. Second thing is now, as you ask, what is vision therapy? So vision therapy is an individualized program. It's totally different for each and everybody. Done by a developmental optometrist or behavioral optometrist for a particular person to use your vision in a particular way or in which we train your brain. Okay, so we learn how to train, work on your eyes and how we can train your eyes to see exactly, to make the best version of yourself. That's what I would say. So that's what the vision therapy is exactly.
Let's get a little bit of clarity. So how does this work for children on the autism spectrum?
Okay. So if in simple way, most of the time we talk about autism, they have different type of problem. Like one of the most important thing you must have seen, like they have poor eye contact.
Yes.
They have hyperactivity, repetitive behavior, poor social and communication. These are the major important thing which we always see, right? And most important thing is we always call them neurodivergent kids, right? Now, what is neurodivergent kid? Let's just discuss one by one. So, neuro or neuroplasticity or neurodivergence is something like, we have learned some kind or we have done some kind of wiring in our brain as we born. So, eye started forming in the body at the 18 days of the birth. Like when we are in the uterus, at the 18 days of the pregnancy, eye start forming. So, which means that eyes are the extended part of the brain. So 80% of your whatever is happening in your brain, that is through the vision only, basically. Second thing is, if I talk about the neurodivergence. So now what is happening, if there will be any type of problem in the development or during the pregnancy, say if your movement is not proper during the pregnancy, which start around the 3 or 4 month of the pregnancy, or if your birth is not normal, if it's a cesarean delivery, that also makes a lot of difference. If it's a normal delivery, that also makes a lot of difference. If it's the suction pump delivery, that also makes a lot of difference. As she mentioned, like, the head was stuck because you are pulling, and here is the most of the nerves are over here, right? Which are linked from the brain to your body, right? Now you're pulling, but you don't know what is going to happen in the future, which is going to hamper your 80% of the learning in your life. Now, after that also, when the child came out, now he should cry, and there should be proper appearance, the color should be proper, the breathing pattern should be proper. That's why we always try to make them cry, after the birth, because the breath should be there. If it is not going to be there, your whole neurological system is going to be haywire. That's why we call it that they are something like neurodivergent. Because the neurological system has not developed the way it should be. Now, after that, there are different type of developmental milestone, or we call it primitive reflexes, Moro, Palmer. So, child learn through the different type of experiences, right? And in that we say, like, they should crawl properly, they should sleep. So when you have seen, like, their one hand is like this and another leg is like this, and that's how we learn about the bilateral coordination. Your right hemisphere is coordinating with the left hemisphere. Why crawling is one of the best phenomena. We always say, like, if your child has never crawled, that means that is going to make a lot of difference in your life. Because these days we are using a lot of walkers, right? Why we should not use walker? Because the major reason, if you are going to use walker, your child will not crawl only. You are directly making them walk. So your crawling is skipped. And because of that, your right hemisphere is not going to coordinate with the left hemisphere. I mean, the interaction is going to be very poor. A later phase, if you'll see, there are many people who will, in normal generation, I'm talking about autism, but if I talk about normal generation, many people have problem the right-left concept. They always say, where I need to take left? Take this side. They don't understand where is right and where is left. You'll always show with the hand, take this side, this side. Where is the problem? Because you have problem with the bilateral integration. Just go and check the history in these people. You will understand that this child has never done any kind of crawling. So that's one thing. Now, so if all these things are not going to be there, your neural connection is not going to wire the way it should be. So that's why they are falling into the category of neurodivergent. Now, we always say that, they have problem in social communication or poor eye contact. These are not the problems. These are the solution of the problems. Yes. Okay. Now, I'll just explain it.
Yeah, please.
So, let's say why they have poor eye contact. So, right now I'm talking to you and my both eyes are coordinating on you, right? And say if I have poor eye coordination where my right eye going like this and left eye is going like this, what I have to do is I have to pull my both eyes throughout the day and I have to focus on you. and I have to put a lot of pressure. So since my neurological system is not coping up with my visual system, so eyes are just like a camera. Everything is controlled by your brain, right? We always say that your muscle is not working, but muscle doesn't have their own brain. They are controlled by your. And since we said it's a neurodivergent kids, neurodivergent it's in simple way, their neurological system has not developed the way it should be, the way normal kid develops. So now, as we said, like if my eye coordination is poor, do you think I would love to look at your face? Because I will get tired easily, right? That's why not only autistic kids, but most of the people who have traumatic brain injury, they also have this type of problem. So we call it convergence insufficiency in simpler way. So they have poor eye coordination. That's one thing. Second thing is, so why they are doing this poor eye contact? They don't have eye contact because they have poor eye coordination. That's why they are doing it. So this is a solution for them. They look over here or right side or towards left side because I don't have my capacity is not to look at you. That's,
Oh God.
that's the simplest answer. Second thing is they have problem in the communication.
Yes.
So why I'm able to communicate with you right now, all these things, because there are some visuals in my brain, whatever I have read over the period of time, and right now, whatever I'm talking to you, already there is a visuals. Because my brain has processed that whole information, whatever I have gone through or the life, that's why I'm able to communicate it well. So if my brain is not going to process the outsider information, do you think I will be able to communicate about that? Now, first and most important thing, at the age of, I would say, 3 to 6 months only, your child starts smiling by looking at the face. When you give a smile, child also starts smiling. Why? Because they are understanding what you are doing. And that's why they are also reacting on that. And they are making eye contact. So initial 3 to 6 months only you will get to know that, what problem is going to be there in the future. Now we don't look at that, okay, my child is going on, that's okay with me.
We tend to ignore.
And again, so where is the problem? Again, the vision is the problem. It's not, we always say like, okay, communication is the problem. The communication is there, problem in the communication is there because this child has problem in the visual process or the vision. So what we need to do first?
Fix the
Visual process or vision. But do we ever do that for autism or autistic kids?
It ain't even.
Yeah. See, there's a parent who's here, and she doesn't even.
Yeah, first time I'm hearing.
Nor am I aware about this.
That's the thing. So that's how the communication works as per my, analogy or whatever I have learned over the period of time. And most of the autistic kids, they have poor visual information process. So they don't understand what is outside because they have poor eye movement and poor eye coordination and poor information processing. That's why they are not able to focus on a particular thing for longer time. Because I try to seek information, whatever understanding. Right now, why are you looking at me? Why are you? I hope you're understanding everything, right? You are attentive here because you are understanding whatever I'm saying. You are understanding my lip sync. If you wouldn't have understood all these things, do you think after 5 minutes you will look at me? So from where the attention deficient or attention word came, it depends upon vision when you are understanding the whole information.
A whole change in the perspective of how we were thinking about all these symptoms, and the solution is totally different.
So this is not a problem for them. This is the solution which they have found. It's like if my right side is paining, of my neck is right side is paining, I won't go towards that side. I'll find a solution toward the another side. That's what they are doing. So I have a problem in the vision. I how will I talk? How will I communicate about that? Now you take to speech therapist, you take to behavioral therapist. Maybe they are doing different ways to talk about that, to work on that. But until and unless a child won't process the whole information, for me, since I have suffered a lot, I think it's not going to be the best. You won't be able to meet the best version of themselves.
I would really love to know how, I mean, what was your journey? You said you had, intellectual difficulties. And how did you, with vision therapy, how did that help you?
Okay. So, well, I'll tell you that, I never got that certification of learning disability because I belong to Himachal Pradesh, and back then there was no psychologist, or maybe if it would be there, but there was no certification kind of thing. And my family is full of teachers. All are teachers. In fact, my father is a teacher, my uncle, everybody is teacher. And just imagine when all are teachers and their children are doing well in their studies, and one person in our family who doesn't like to read, and he has. So I always used to get fascinated by something like detailed kind of structure, pictorial memory. And I still have pictorial memory. Once you will show me something, I'll never forget in my life. That's what happens with the autism kids, Once they will get love with something or someone, they will look at the texture of that toy, or they will get fascinated out of that. That's what I used to do. And when my cousins used to get 100 marks, 100 out of 100 marks in maths, I used to be like, 20 marks. And I never feel ashamed out of that, because that's why I'm over here in front of you. And I never knew why I'm suffering like that, but God has a different plan. So I was like, I was doing like that, and still I used to struggle, and my head used to ache a lot. My parents used to take me to different doctors, and they used to prescribe some different type of glasses. Same, zero result, nothing. My head again, it used to ache a lot. And that was not the biggest challenge, but the challenge used to come when society started telling me things. And I used to feel the same, because my parents has to go down because of this particular thing, because I was not good in studies. And a lot of time people used to ask me, what will you become when you'll become something like big? Or I always used to say like, I will become something like driver, and they used to laugh at me, and because I never loved reading, that was the reason. Somehow I got good marks in 10th and 12th, and I joined Optometry. I did my Optometry. I completed my 3rd year, and I got introduced with this vision therapy. So there's a world-renowned behavioral optometrist, Dr. Robert Sumit. He has been my mentor for a couple of years, and still he's mentoring me, and I've learned from him. In fact, his journey was also something like this, and he has taught in 32 countries. So in the year of 2015, he came to India and he taught vision therapy, where he mentioned that we should not patch our eyes. Maybe you must have seen we for lazy eye, we cover the one eye. So it's not the one eye problem. It's why we are going to patch your one eye when we have both eyes, when we have got two eyes. Right, so we should not patch our eyes. So he has the legacy of 25 years. He has never patched any eye. This was the thing in 2015. We are in 2025. Still, you might see, every third child is patching their eyes. Right. So it's not covering your one eye. Just imagine what is the behavioral changes which are happening in the brain when you're covering one eye. So he explained about vision therapy, and he was a behavioral optometrist. So he explained that how vision changed the behavior of a person. How this poor eye coordination or poor eye movement can change the brain or behavior, like the way I communicate, or the way I write, the way I look at the way I walk. Everything depends upon your vision. So the moment he explained about this thing, I thought like all these things are happening with me, and not with me, but if I'll talk about today, 70 to 80% of the people have visual problem.
Yeah, as I said, even I'm able to relate. Because yes, it does make a lot of difference.
So, but we are limited to the model, which is very small. That is what we see. It's not how we act upon the things. So we are dealing with the light all the time, right? So the light is going to your brain, and your brain is understanding how much light I need to take or how much I need to not to see. That's decided by your brain. So he explained something about vision therapy. I learned that. After that, I did for myself when I did my internship. I used to do, 45 minutes, 1 hour of vision therapy for myself. And during my internship, I got an opportunity to work with special kids in Bangalore. And I would say that's the first hospital where in all over India, Shankara Institution in Bangalore, where we used to see special kids for vision therapy, because my principal was attached with that hospital. Since we have learned from Shankara Hospital and Shankara Institution. And we studied from there, and I was doing vision therapy for myself. And then after that, I started reading things. Then in the third year of my optometry, I learned about this vision therapy, how does the vision affects the behavior. And somehow I was not very clear, but I was still following that model. Okay, my eye need to be fixed and my both eyes needs to be coordinated because I have this poor eye movement, poor eye coordination. In the fourth year, when I have to do internship, I started doing vision therapy for myself. So, after the 7 o'clock when we go to the new department, that time we all have to do vision therapy on ourselves so that you can explain to patient in a better way. So when we go into the internship or when my vision therapy practice started, vision therapy part started during my internship, there are different postings exactly, because there are different departments. So during my this particular vision therapy posting, we have to do vision therapy for ourselves. And so that, we can explain to the patient in a better way. So I used to do for myself. And I did it for 4 or 5 days and I felt much better. And then I continued all after 7 o'clock when all the patients used to get over. I used to do it continuously for myself for 1 hour. And after 40, 50 days, I started feeling different changes. And somehow I liked reading. And I was like, something is different in my life. Because now my peripheral awareness has opened. I was more relaxed. And simultaneously, I was seeing some autistic kids in clinic. And thankfully, I would like to say thanks to my teacher also, my senior. She gave me opportunity to work with special kids. And I was the boy in this with the 3-4 girls. So all the special kids I used to see. So she was like, you see all these kids and even if I'm not there, you keep seeing this. And that's how I got an opportunity to work with the special kids. So I was thinking thing which I had in past, same thing is happening with these kids also. So there was cerebral palsy, there were, autistic kids, learning disability, all these kids used to come over there. And then I got a catch I need to go into this field and I think I should do more and more, and so that I could reach to mass and I could transform the life of many people. That's what my journey. And today I'm doing PhD in optometry.
Ooh.
So from learning disability kids to PhD, I think it's been a long time journey, but
it's an amazing transformation. Beautiful, beautiful. I have many more questions for you. But before that, let's have insights from you, ma'am. So you are a digital creator and we have seen you put in your, everything is true. You just don't show the good side. You have also put in the true kind of scenarios. So how do you create all of this? And then how do you decide whether this has to go, this content has to go, or this doesn't have to go? So how do you decide all of that?
So every day I was getting questions from the society about Dian, about his sensory issues, about his speech, why he is behaving like this. So I thought social media is the best platform to share information, to connect with people, and it is the most widely used platform, right? So I thought that I should use this, and uh, every night, no, we chant prayers. So he remembers all the slokas. So one day I have noticed that he was taking a video of it. So immediately I decided to post it online. Then he has good passion in sports. He is doing very good in sports. He is doing shot put throw with 4 kg ball. And he secured second position in Fit India competition, which was state level competition, being the youngest. So I thought that I should post all these things online so that he can become inspiration for others. And then he had a small part in Sitare Zameen Par movie. So I believe that no role is big and small. Of course, participation is what matters. So I thought that I should post all these things online so that he can become inspiration and people can learn with that.
Wow, which is a very amazing thought. I mean, you two totally relate into and are so very similar that you also want to give to the society and you also want to.
And somebody spoke and changed my life. So I thought that I should speak to change lives. It can help other people and they will feel less lonely, I feel.
So now you have that sort of a responsibility on you that whatever content you put has to be relatable, has to be correct. So how do you take care of that?
See, we can't change the situation, right? I can't change the situation. So whatever you go through, if you want to cry, cry. But after some time, wipe your eyes so that you can see clearly. And I feel every morning we have two choices: either be miserable or be happy with what you have. So I always choose the second option, and I always apply this theory in my life and share with my followers also that. And now I'm feeling that I'm a better mother and I'm a better version of myself also.
Which is really amazing. Also, social media nowadays is playing a major role
Yeah.
in everyone's life. Like, be it a child, be it an adult, everybody is into it. So, how do you think has social media changed the lives of parents, of children on the spectrum, and also children?
It has changed lives. They had this misconception that if child is behaving a certain way, it was all parents' mistakes. But now they are realizing that some children are differently built. They take time to understand, and so I feel it's about changing awareness to acceptance.
So you think social media is playing a very important role in creating this awareness and acceptance? Nice, which is really a good change, I should say. But there is a lot of mixed information that we get on social media. So how do you think that can be taken care of? Or is that even possible?
I don't think
I think I can relate with her personally. First thing is, as she mentioned, like when your child has some kind of problem, we see like, I mean, personally, I get most of the referrals, so directly patient doesn't comes to me because people don't know something about vision therapy, right? But when they come with the referral, then also, we tell them, oh, this is your child has some kind of visual problem. They are like, I don't think so. He can see everything clearly, but that's not the thing.
Correct.
He can see, but he doesn't understand or process the whole information. And same thing, like I'm also doing, I'm trying to create a lot of awareness with the people by doing using social media, other seminars, webinars, whatever we can say. So for for me also, it's similar. Like maybe I don't know how many people are going to watch me or how many people are going to see my content, and some of them are like going to be like, okay, this guy is talking something rubbish, but at the end of I know what I've gone through and what I'm going to give the people, and that's the goal. And I think we are matching in that. Second thing I would say, as she mentioned, like many people say that, giving phone is not good to kids. You can't
Yes.
give the phone. For me, I feel that, it's just a part of the life. Now it has become. See, phone is never going to spoil your life. It's like how you need to use your phone. That makes a lot of difference, right? So earlier we used to communicate with the kids. We used to give smile and we used to talk. That's how they used to learn the language and communication.
Correct.
Now, these days, if you'll see child after the age of 1 year, we always play the, this thing, whatever you call Peppa Pig or, any kind of stories, rhymes. And then we feed them. And most of us are working and we never give or connect with the kids. Now, how this child is going to learn communication or what he is going to learn? So, he's seeing. So, basically, again, the vision comes into the role. You learn from the
What you
vision or see, but what you are learning over the period of 3 years, during your journey, phone.
is why.
So it's not phone is spoiling their life. That's why we say that these days there is a new term which has come up like digital autism or what?
Yes, virtual
Virtual
autism.
new term.
Yeah.
What is virtual autism? It's the autistic science which has come because of visual process. What is phone? It's a vision which is changing your different process. Right? So it's not, we say like, the everyday third rule is like use 20-20-20 rule. Who is going to use that 20-20-20 rule? Like, even if you're working on computer, is there anybody? Just ask that person, the one who is talking about that, is that person also using? Nobody's. Because there is a cute word, awareness. We lose the awareness in our life when we go continuously towards the phone or digitally. Right? So the biggest problem these kids have, they can see, they are aware about everything. The awareness is not there. I don't know what is going on in surroundings. I don't know how I need to organize my space. That's why I keep jumping, I keep flipping my hand. Now there is a biggest problem when we have poor eye coordination. We also have poor depth perception. Okay. There is something called as 3D vision or depth perception. All of us are dealing with a 3-dimensional structure. Now just imagine when you have a poor eye coordination, you don't have 3D vision. You actually have 2D vision a lot of time.
Okay.
So which means you see everything flat. Okay. And when you're touching, you are feeling it's a 3D structure. But when you're seeing, that's a 2D structure. So what is going to happen in your brain? There will be mismatch between what you are seeing and what you are touching. And when there will be mismatch between both the things, just imagine if same thing is happening with you, how will you feel? Will you feel safe in that space?
No, definitely not.
And if you're not safe, what you will actually do or how will you react?
Escape.
Will you shout? Will you cry? Yes. Or you'll go away from that? Will you feel claustrophobic when you can't organize the space? Now, what happens with the autistic kids? Same thing.
So, if I may ask,
Yes.
how do these children on the autism spectrum see? How is their vision?
Okay. So, most of the time you will see like, we can say double vision is the thing because I'm not able to coordinate my eyes.
Okay.
And a lot of time you will see they do visual steaming also. They always track. Now, why there is a visual steaming kind of thing? So just imagine if right now I can see double. So how will you make it single?
Yeah.
I will see like this because right now I'm seeing with this. This side is going toward this side. So I'm blocking the vision of this side and I can see you better. A single. Or this way. Or either I'll see like this. So that's why they do this visual streaming to avoid that double vision or the problem, the sensory problem which they are having. Because whenever the light is coming, so what my pupil does, it change its size, which is controlled by your autonomic nervous system. That, and it is that nervous system which is connected with your whole body. I would say your heart, your gustatory, digestive system. So everything is happening to the vision. It starts from the vision, I would say. And when you ask, like, so they have double vision, a lot of time it's like they feel the object is moving around them. And I have personally seen a lot of adults also when they come to explain about this thing, that they feels like things are moving around them. Or there is a book written by Temple Grandin, like visual thinkers, how do they see exactly. So she has mentioned a very important thing in that, she has described like how a mansion see and what is the vision of the engineer. Why an engineer is engineer and why a mansion is mansion? Because engineer can read and understand things properly. And if I talk about a mansion, he can also see. He's doing his process, but he's more detailed about the structure. He understands the pictorial memory. Like I was a perfectionist in my life. I still want perfection. If you look at these people, they always see everything in a detailed manner. They go to the close because when they got a catch into something, they always want to learn about that. Okay, what it is? How's the structure? They are trying to understand that. And they might like the fragrance of something.
So they get into the details of
that. So how do they see, if I'll tell you? They have something like a pictorial memory, or I would say a lot of time they get double vision, wavy kind of thing, also flat things. And for them, the way I can organize your space, I know this particular thing is over here, this is over here. For them, maybe it looks jumbled a lot of time. And that's why you must have seen a lot of kids who has autism or ADHD, they do toe walking. Now, why they are doing toe walking? That's also one thing.
yeah.
Okay. So people who have toe walking, they always go to physiotherapist or occupational therapy. They
Yes.
say that, we treat it as a occupational therapy. Now, for me, the way you see, same way your body works.
Correct.
Are you agree with me? So just imagine if you are seeing space like upward or downward, what you are going to do? How you are going to walk?
This is giving me goosebumps.
हाँ एक्चुअली दियान तो बहुत बार करता था.
Yes, and I'll tell you that, I've seen many stories, and I have personally cried in my clinic, and parents a little cried, the movement we put some special kind of prism lenses or yoke prism. You don't need to wait for 5 years, 10 years. 2 seconds. Within 2 seconds, you can change that toe walking thing. Not 5 years, not 10 years. 2 minutes, 2 seconds is the time. And you can ask, since I work with a lot of occupational therapists, they have come and they have seen it live. And when parents see this thing, they literally cry that, I didn't know this for so long.
Yeah, because they are all what they're doing depends on what and how they are perceiving and they're seeing things. Oh God.
So this is the story, and then it's whatever I'm talking about. It's my experience. Even if I have read a lot of books, but still, whatever I do in my practice, and I teach about that, I talk about that. That's what I think I should talk about.
Also, I would really want to know how exactly does vision therapy work? How do you do it?
Okay. So whenever a child comes to me, I evaluate his visual system, how he is coping up with the world or the space. So say, we do different type of tests. We see how's your eye coordination, how's your depth perception, how's your eye movement, how's your focusing skills. So we also understand how your brain is perceiving the image and how your brain is reacting or, perceiving the whole image. And most important part, visual information processing. We do test about all these things. And with that, we evaluate how's your primitive reflexes, whether there's any delayed or any kind of changes in that. And after evaluating all these things, we prescribe them lenses. For me, lenses does 80% of the work. And there are two types of lenses. There are something called as compensatory lenses, which 99% of the people prescribe. It's like, I can't see, take this minus number, go back. My work is not that. I try to find the cause of the problem. Why this has happened. So as I mentioned, why this child is doing visual staining. That's not the problem, that's the solution. But why he's doing that? So I need to understand that. And whereas every child is different, so a lot of time people say like, can you do online thing for me? Or can you do online evaluation? I am not a big fan of online evaluation. I want the child in front of me. And a lot of time I go in the waiting lounge and, can you just come inside? How are you? A lot of time I have to sit because when they see this, my chair unit or, consultation room, they get scared because last person who has done the eye checker, they have put the drops in their eyes and they don't want to go to the eye doctor, right? So I don't put any kind of eye drop and we try to do the evaluation of this child. A lot of time I might sit in the my waiting lounge only and I will do the evaluation over there. Or I don't have a fancy kind of something big evaluation. No, I can sit down also with the child. I play with the child. And I might ask a lot of questions if the child is verbal. And then after the evaluation, I will prescribe the appropriate lens prescription. Now that lens prescription is going to be different, not the compensatory lenses that I mentioned. It depends upon person to person, how the child is performing, behaving, and we'll make them walk, we'll make them do different things. A lot of time you will see changes within 1 second, or a lot of time it will take 6 months also. And then we'll make them a vision therapy plan, which they have to come as 3 times in a week or 2 times in a week to office vision therapy. In vision therapy, we do use a lot of softwares. We have manual things also. And since I'm not a big fan of softwares, people these days think like, vision therapy is all about, you are touching it, tracking it. That's not vision therapy. You need to guide, you need to tell something. Okay, your brain needs to interact with the things. And with we do a lot of activity like eye movement, eye-hand coordination, or depth perception training, and proprioceptive awareness. Plus, we also work on primitive reflexes. And I find till that time you want to work on the primitive reflexes, your child will never get the best results. I'm not talking about autistic kids, but also the normal kids. So we treat squint also, like people, you must have seen crossed eyes.
Yes.
I'm not a big fan of squint surgery. And in my career, I have never asked anybody to do the squint surgery in their life.
Okay.
And I have treated huge amount of squint, like vertical, outsider, invert. You talk about vision therapy. Wow. And so we do primitive reflexes training. Plus there is something called as light therapy. So these days people say like, we should take red light therapy, it will work. I think it doesn't work like that. For all of us, we work to the environment in a different way. And we all need to take different colors, not like red color. If you give a red color to autistic kid, that child can turn into hyperactive nature also. So for all the people or parents who are giving their child this red light therapy, I would say, please consult with the behavioral optometrist or developmental optometrist or person who is specialized in syntonic phototherapy. You can't be like, just today I'll go and, take this minus lenses and go. And I would say 80 to 90% of the people are still not well versed with what actually autistic kids are doing visually. And that's why we are here.
Coming over to you, ma'am. You have mentioned that your child was denied admission in school.
Yes.
So, what was that whole experience that you went through?
So when he was 5 years old, we shifted here from Kharghar to Kharghar, Navi Mumbai to Kandivali. So we tried all major schools in our area for his admission. They all were denied. They were saying that we have only 2 seats per class for these children and all are full. So I had I was feeling that I had failed as a mother, and we were ready to pay such high fees, but still they were not ready to take him. So I feel that all the schools should support these children. They also have right to education like any other child. So we know that they learn differently. They take time to learn, but we need to find out ways, right, to teach them. So all the schools should support these children.
I completely agree to this particular point. Also, you as a digital creator, how do you see inclusion?
True inclusion means to me is creating a world where my child is not only allowed to be present, but also genuinely welcomed, valued, and understood. It is about shifting awareness to acceptance. That is what I feel.
True, very true. There was a therapist who came last. He said it should not be out of sympathy.
Yeah.
It should be out of genuinity that these children should be given a fair chance because they are capable of a lot of things.
They are capable of
Yes.
things, and they are much more than these labels and scripts.
So true. So, yeah. Fantastic. Also, as a parent, you must have gone through like when in the beginning you were unaware of a lot of things, puzzled. So, through your social media, how do you think you can cater to these, parents who have just started their journey?
I want to say one thing that accept your child the way he is, educate yourself, discuss with more people so that you can give the best to your child, and do the best you can until you know better. And when you know better, you can do better, right?
Perfect.
And someone's opinion about your child does not have to become your reality. You have to work hard, you have to learn, and you have to be ready with your child to work with your child.
And we also know you did mention that Dian is really good in yoga and also sports. So tell us about that and how, how another parent will identify that, yes, my child is really good in sports. And how do you think can you pass on this message of looking onto this angle as well?
So genuinely speaking, he was very much hyperactive child. He has diagnosed ADHD. So in order to channelize his energy, I put him into sports and exercise. So at the beginning, it was very difficult for him to exist. But now he seems to enjoy it and it has become his passion. And now he's doing very good in sports and yoga.
Wow.
So it will be good for them to channelize their energy and the hyperactivity.
Expose them to everything and then realize and understand what they're good at. Nice. So coming over back to Sir, I also want to know that how should a parent identify like when they have to go to a vision therapist?
So if I talk about when they should go, I always feel that initially in the first 6 months only you'll get to know that is my child has any kind of problem in the vision or not. If the child is not looking at the object, if the child is not giving any kind of smile or reacting toward the object, when you are showing light or this phone or toys, what is a sign that this child has some kind of visual problem? So you need to go to an optometrist who will evaluate all these things. And so in the earlier phase only, you will get to know, these are the problems, so I should consult with someone. But we go to other people and we never got diagnosed with all these things. And after 3 years or 4 years, you go to search someone like eye doctor or vision therapist or anybody. That time, at the age of 4 to 5 years, you have to put the child into the school. So you lost your 4 years, right? Whereas if you would have started some kind of visual intervention at the age of, say, 6 months, 1 year, 1.5 years, you would have made this child better. So I would say you need to do visual evaluation as early as possible if you find something wrong with the child. The signs are like, as I mentioned, like if your child is not reacting or doing something abnormal, vision is the first sense, I would say. Okay. And first developmental milestone also.
True.
You look and then you grab the object. You look and then you react towards the thing. Definitely there is auditory and touch, but you can't be like looking in the space. But when you see, then you grab. So I am assuming that within 6 to 8 months is the crawling period. So when you start crawling, before that there is a rolls over. There is a slipping pattern which we see. So when you are rolling over, you are seeing how the child is rolling over. He's understanding about the space. And then they push the floor. They're understanding how close and how far I need to go. All these milestones needs to be there. But if child is going to lack all these things, what is going to happen? He will not crawl, he will not walk, and it's the right time to go ahead with the vision evaluation. So then we'll plan the vision therapy. First thing is vision evaluation, and which should be done by a developmental or a behavioral optometrist, because they are specialized. They have learned how the visual system works, not only the eyes, but complete visual system and body.
Okay. So to reinforce this,
Yes.
so you should go not to an eye doctor, but
Behavioral optometrist.
okay.
Yes. Now again, why I said this, like we should go to a behavioral optometrist or a person who is specialized in vision therapist. Most of the eye doctor think about the eyes, and we can say about the brain also. But when we talk about the behavioral optometry, a person who is specialized in neurovision rehabilitation, the way I did, our analogy is totally different. The process or the thought process towards these kids is totally different. How these kids act or work with the space. So your analogy makes a lot of difference. Say there are a lot of physiotherapists who only works with the hand movement. There are a lot of body coaches, or I would say trainer, gym trainer. They only work with the muscle, but some of them, they are like how your mind and body works. So totally different things, right? Same way, there are eye doctors also, and there are optometrists. An optometrist is a person who has learned 6 years about this thing. So that's what my
Focused.
Yes.
Yeah.
So I'm trained about that. How to do this thing, how do we cope up with, or I know actually how I need to check, or what is the problem, where is the problem.
And why do you think there is, I can say, almost very less awareness about
So
visual therapy?
first and most important thing I want to tell is, in all over world, there is only one college in US, College of Optometry and Vision Development. We all have to do some fellowship program from there. At least after doing that fellowship, you will learn how actually vision therapy works, or how the vision change the behavior of a person. So it's a fellowship in behavioral optometry or neurovision rehabilitation, we can say. And then your understanding change toward these kids. Now, this fellowship is long time, and many people are, they are not able to pass this. And for all of us Indians, it's very difficult to go to US. And even if I'll talk about US, there are very few people who has done this fellowship. And plus, if I talk about this visual process and this vision therapy, what I've learned, it's very difficult to explain and to understand also. We think like vision is something like to see, but there is a huge, you can't just explain to in the short line or the something. So a lot of time people ask me like, can you come for 5 minutes talk or 10 minutes talk in our conference? I'm really sorry. It's very difficult to explain in the 5 minutes or 10 minutes. I need at least 1 hour to explain the only vision.
Correct.
Or if I say vision is this thing, they won't understand anything. And that's why people mistakenly understand it in a different way. That's why a lot of people are not aware. And even if I talk about the parents doesn't know something called vision therapy or behavioral optometry.
No one knows.
So say there is a parent, he wants to do something, even if he know that, my child has some visual problem, they will go to eye doctors.
Yes.
And when you will go to eye doctor, they will make you read some chart. Now, if you'll tell me, I feel out of 100 autistic kids, 10 kids only can read that chart.
Yes.
Because most of them, they are non-verbal. And now, when they can't read, then how will you evaluate these kids? And most of them, they don't have structural problem. They only have functional problem. They can walk, they can do everything.
Yeah.
But the process is not happening the way it should be. For them, all the time, it's like sensory information is coming. Too much of light, too much of audio. But I don't know how I need to manage with that kid. So they go to eye doctor and then eye doctor say, your child is doing perfect. He can read everything. But they don't understand how the process is happening. That's what the behavioral optometrists or a vision therapist do. And we evaluate that and we work on that and we can make a child better.
Any day much better.
Yes, I have many stories where I have worked with many kids and I feel every child is different and we can make the best version of themselves. Even if I talk about normal person. So I get a lot of normal people who have this type of problem where they don't know that they have autism or something. But they have, I'm not aware about my body. I don't know where I need to look. But they are just coping up. So we put some lenses, prisms, or we do vision therapy and they are like, wow, this is what I wanted. And it's not only that, your breathing pattern, everything depends upon your digestive system, everything depends upon your vision. That's another
We
story.
never knew all these things.
Now, when you are over focalized, how do you go? You always go to like this, right? And when you're focusing, what happens to your breathing pattern? It's shorter, right? Your posture, right now I'm sitting like this, my breathing pattern is smaller. Now when I'm sitting like this, I can breathe properly. So that breathing pattern is again connected with the autonomic nervous system. So it's a completely, vision, but we are just stuck to that particular thing that, whatever we are seeing, that should be there. And so now when these kids go to eye doctor, they say everything is perfect. They never send to behavioral optometrists or optometrists who are trained in vision therapists. That's how. So it's a completely different domain. So if anybody who has problem, I'm assuming that in Canada, Australia and US, everywhere there are vision therapists. And people who have gone to vision therapist, they have got the best result for their kids. And it's like word of mouth is the only option which we find today. But I hope with the help of all of you, we can just...
Definitely.
Yes.
Definitely. I think, ma'am, all of us are in so much of better knowledge about this that definitely
It was very informative.
very.
we only talk about autistic kids who has poor eye contact. Just talk about the normal person. And in most of the normal people also, they don't make eye contact. It's just like their behavior is not reflecting that much. They are coping up somehow with that. That's why they are okay. That's why we are not writing them autistic. Nowadays, you will see every third person is saying, I'm ADHD or I am having autistic symptoms.
Traits.
Why it is like that? Because we are now we are living a life where it's 3 meter, 2 meter. Who is looking at a 6 meter? Now, you go to any eye doctor. How many of us are, checking near vision? We always talk about distance. Nobody's thinking, but are we really working at 6 meter? Talking about metro cities. How many of you have, 6 by 6 ka room also? Most of us, we don't have. What we are doing near. Talking about the eye contact also. If I will look over here and then I will talk to you. What do you think? This person has some problem. But you want to understand why I'm doing that. You will look at my behavior. You want to look at why auntie. That is I. That's what we do with the autistic kids also. You don't see why this child is doing this. You look at the behavior that child is showing to you.
And you try to fix that behavior.
Yes.
Rather than identifying.
Work on the cause of the problem. Treat the problem of basically cause of the problem. And the moment you'll treat the cause of the problem, your child will do better in his life.
I know. In fact, the child will feel so much at comfort.
Relaxed, comfort.
Yeah.
That's what we can.
You did mention that you have a lot of stories. Can you just share a few at least?
Yes. So, as I mentioned, there was one child, and day before yesterday only I'll talk about one child. So, this child is having some kind of behavioral problem. He also has the history of premature birth. Plus, there is a cortical visual impairment. And if you look at the MRI, you won't be able to see the child, this child can walk or this child can see things. Okay. Now, this child has a nature that both the parents are working and child is living with nanny at home. And full day this child is on phone or, he's playing out with the kids. But kids doesn't like to accept him because he's something out of the zone. He is not able to cope up with the... And even when he goes to school, he is lost. Something like you must have seen Tare Zameen Pe movie. Dyslexia is just like a visual problem. It's not because your letters jumbled and... But we never go to a vision therapist. Right?
Yeah.
I didn't know.
So, this child, the one I'm talking about, he has some kind of visual problem. And he went to psychologist few days back and then they had diagnosed mild autistic kids. Now, day before yesterday, I was talking. So, whenever he comes to me, I don't do anything. I just talk to that child. I have therapist who does therapy at my clinic. And whenever he comes to my room, I talk to this kid every time. So, since past 3 to 4 weeks, I was talking, and this time also, I was sitting in my room, and then he came and he sat with me. Why he must have sat? Because I communicate with him. I understand this child, what he is going through exactly. And same thing, when my therapist gives therapy to this child, and if they try to force him, like, you have to do this, which we don't prefer. I never ask any therapist to force. We always say, focus, dhyan se dekho. No, that's not the analogy which we need to follow. He has been focusing over the period of time.
Yeah.
That's why the problem is there. Now the time to do opposite.
Okay.
So and if you'll tell this child, you have to do this thing particularly, he starts slapping himself. And then I spoke to his granny and then, how do you feel? What is the changes? So she was like, he has got a lot better since the time we have started vision therapy. And he had squint also. And then she mentioned that, he is staying with us throughout the day and he's on the phone, and then because he doesn't go out to play with the kids and his parents also doesn't allow. The reason behind that is these kids doesn't understand him. Now when we are doing vision therapy, now he is more relaxed, more calm. The most important thing what I want to tell through this story is try to listen them. Try to understand them, what they are going through exactly. And the moment you will start doing that, I think 80% of the problem will automatically solve. I understand they have a problem, but we need to understand what is the problem and work on that.
So true.
That's how it is there. That's how we have many stories, like as I mentioned, a child was having toe walking. I just put the lenses. He started walking perfectly within 1 second. Parents were full of tears. It's like a magic. For me also, a lot of time, it's like it gives me goosebumps. Like, when I see these changes between 1 second. Or I've seen many child, they never used to talk. Zero communication to today, he's like continuously talking, blabbering.
How?
By doing vision therapy. Yes, this is truth, and I am telling you that vision therapy can improve the communication of the child. I know it feels he's talking something out of the world, but yeah, this is truth. I can show you many stories. If you want, you come to my clinic, you come talk to parents. Maybe they have come for something else, like to fix their eyes, to make their eyes straight, but to make their eyes straight is not the problem. To change or to make another human being or the best version of themselves is the best. I mean, that's the goal of the vision therapy.
Okay.
We believe on the concept of neuroplasticity, which means that our brain is ready to learn everything at each and every time. So I have seen patients with the age of 80, 75, 60, people who have gone through traumatic brain injury, or we can talk about Parkinson, multiple sclerosis. They also have visual problems. And they also do vision therapy. So it's like we are working on the brain. We are not working on the muscles. If I'll train your muscle, after 2 days, it is going to be zero. But if I'll train your brain, once your brain will learn, you won't forget that. And how your brain is learning, it's learning through the neurons. So that's what the neuroplasticity says, that there is no age bar for vision therapy. You can do vision therapy just after the birth and just before the death. That's the difference. Okay, there is no age bar. And you talk about all the neuroplasticity studies. Again, there's one of the best book written by, we always talk in the behavioral optometry, Sushan Berry. She has done 3 times squint surgery. And even after doing squint surgery, she was not able to see 3D vision. And she herself is a neuroscientist.
Okay.
And then she met with some behavioral optometrists, and she was like, will you be able to work for me? And she did vision therapy, and she improved her life. She changed her life. She transformed her life after doing vision therapy. She wrote a book, Fixing My Gauge, after that.
Great.
And today she's living happy life. She has given a lot of talks on vision therapy, TED Talks also there. And that's how the life is.
Wow, transformations.
Okay. So like this, same way, there are many people. There are some sports people. So even if I talk about sports, they also need vision therapy.
Yeah.
Right. 80% of the things in the sports is vision. How far, how close, how fast the object is coming. It's not what you are doing with the hand, but it's depend upon your vision. How fast I need to react, reaction time. Now in Indian scenario, we don't have anything like sports vision training or sports vision therapy. That's how it is like that. And in every domain, I would say, in computer user, general life, every third person have visual problem, and it is going to increase in next 5-10 years. It's going to be 10x. Because in simple way, I'll tell you, like these days we all have a simple scenario. Whenever you open your phone, your finger will automatically go towards the Instagram.
Yeah.
Now, why this is happening? You want to do something else. You want to call someone, but you have
Such a me.
your
I don't.
your finger is going towards that. Why? Because this is what you have been doing since past 3 months, 4 months. So your visual process has learned that. And till that time, and you are not doing it consciously, you are doing it subconsciously.
Ah. And then I forget why I took the phone.
Yes.
Exactly.
Wait. Now after 5 minutes, you're like, why you took the phone?
Huh. And there was an important call that was supposed to be made, and then that's gone.
And it will go for not for 5 minutes, it will go for another 2 hours.
Oh.
And then another scenario is, so there is a person who comes to my clinic, and so since we call us as a behavioral optometrist, so there is a lady, she is like, throughout the day I feel like I want to do something productive, but I end up doing something like, oh man, I have not done this today, so now I'll do it tomorrow. This is how we are losing our life. Now you will become this, you will have anxiety, procrastination, and all this stuff.
All these problems, yeah.
So
You get into that frustration.
yes, and just imagine when a normal person can go into this domain. What about the autism or autistic kids? They have all these symptoms in a 10x manner.
Yeah. Oh, this is crazy. So you did mention in the next 5 years, this is going to be 10x. So where do you see vision therapy in the next 5 to 10 years?
So I feel that since vision therapy needs to, practitioners who does vision therapy, it should increase, and it is definitely going to increase, since now people are reaching for this fellowship program, or people are doing fellowships. But I don't know, still, if I talk about the behavioral optometry, still it's very less. I would say there are 3 to 4 optometrists from India who has done this fellowship. And people are working on the vision therapy perspective, but their perspective or their analogy is still to fix the eyes, not fix the human being. That's why we always try to cover the eye. Even if you'll go to thousands of people who does vision therapy, but they still give the patching. A person who is doing vision therapy and who's looking at the behavior of a person, they will never patch the eyes. Why? Because you know what is going to be the side effects of the patching. How he is going to eat or how he is going to walk with one eye. So within 5 years, definitely the visual problems is going to increase. So that the vision therapist also. But there needs to be guidelines, which we in India still, we are very poor at that. Anybody can do anything. There are many people who claims that we are vision therapists, but if you look at their qualification, they don't have. So I feel that as a qualified person, I have done bachelor's, master's in optometry, and currently I am pursuing my PhD in optometry, where I am working on autism again. And plus vision therapies, fellowship and program. Every year I learn from US on this behavioral optometry, so developmental program, which I do. And same way I feel everybody should do to upgrade your knowledge, and we should do this. We should go to optometrist. Look at the qualification. Is this a qualified person for the vision therapist or not? Vision therapy or not? Again, if I talk about Canada, Australia, US, they still have some guidelines, or UK. There are person who specialize in behavioral optometry, and they are only practicing. But here, if I talk about India, anybody can do anything. Just imagine that a person who is talking about this, do you ever go and look at that person? There is a person who has studied that dietitian course for 4 years. He has learned. If you are going to give the whole knowledge, what he is going to do? So I am a vision therapist. I only need to talk about vision therapy or optometry. I don't need to talk about dietitian. For that, there is a dedicated person who has done some qualification and who is doing fantastic job about that. So that's where, when I talk about this, parents should look at the qualification, go read about that, rather than stuck into something.
For that, social media plays a very important role. So a big responsibility that you have, which is fantastic. Now, Sir gave his experiences that he had. I also want to know about your experiences, your best time with your son. What were those moments?
First of all, when Dian looked into my eyes and said, "I love you, Mama," that is best for me. It means the world to me. Sometimes he says, "Mama, you look great. Mama, you're looking beautiful."
Oh, wow.
So so it's much more bigger than anything, I feel. And yeah,
Beautiful. I mean, yeah, these words are, precious. Precious.
So yeah, that's what, like, when as he said, when child start talking or child looks into your eyes, that's the biggest transformation which we see after doing vision therapy a lot of time. I mean, yeah, for a parent, it's the biggest thing. Like, even if they are blabbering or they are saying something or they are communicating or they are trying to communicate, it's the biggest transformation.
yeah.
And if I feel that if I can do something like this for someone, God has given some blessings on
True.
all of us. And
So true.
so that's.
Though I don't want to end this, but as we have time restraints, so one message that you would like to give to our audience, sir, and then one message from you as well, Matt. So yes.
So I feel that whenever if you see signs where your child is not able to walk or communicate or look, try to consult with behavioral optometrist. And I always say, one thing, that vision right equation for body to move. Okay, so it's a quote given by someone, something like this, and then another quote given by Marley Ponte. Vision is the brain's way of touching the world. Okay, if you want to touch the world, and if you don't want to move your hand, you can touch by your eyes. So vision has a big domain, and it's a, big opportunity for a person. If you all parent or anybody, any child has any problem, they should consult with the behavioral optometrist. That's the first thing I would say. Going to another part also. Definitely, if your child gets diagnosed with some kind of problem, they should consult with the behavioral optometrist. They will help you out and make your child much better and transform their life.
So I want to say, each and every child with autism is different. So accept your child the way he is, and I want to see more understanding society. I want to see more accessible spaces for these children, and more inclusive society.
Perfect. In few words, but perfectly. Thanks, both of you, and lot of eye-opening moments today. In true sense, our vision is pretty clear. So thank you so much, both of you.
Thank you.
Thank you so much.